Thank you very much, Asti and team. It's a pleasure for me to welcome our members and our guests to this webinar. Very, very relevant. The future of healthcare. I believe that all countries around the world have been in a state of shock for many, many months with regards to the pandemic. There was very, very little planning, no plan B, no plan C, no plan D. I do believe that actually now the focus around the world will be on how we plan for the possibility of further shocks with regards to our healthcare. In particular, I would like to thank our moderator, Donny, who is also Vice Chairman, as Asti mentioned, Vice Chairman of the Board of Management of Indonesia. I would like to personally welcome our panelists, Dian from Prudential, Jean François from Aden Services, Nathan from Allo Doctor, become a very, very familiar part of the domestic infrastructure of many homes in the last few months, and also Ibu Lia. In particular, I'd like to also express BritCham's appreciation to our sponsors, the Prudential and Rent-A-Kill Initial. And there's only one other thing I'd like to say, and that is that as we move into this year with very much a similar MO to last year, to those of our members that are on this call, we sincerely would like to use these webinars as an opportunity for you to share information and intelligence with others, not just our members, our wider stakeholders, both in the UK and in Indonesia, and for that to represent an opportunity to brand your expertise as well. With that, I really would like to hand over proceedings to Pat Donny. Donny.
Pak Doni, excuse me, you're still muted.
Sorry, actually, can you hear me now?
Yes.
Thanks, Chris, for the introduction, and a very good afternoon and morning to all the participants wherever you are in the world. Welcome to our BritCham Indonesia webinar series, where today we will talk about the future of healthcare infrastructure in Indonesia. We're joined by many distinguished panel speakers, as Chris had mentioned, which I will get around to introduce a little bit more about them very shortly. My name is Rino Donosepoetro, Vice Chairman of BritCham, and it's my pleasure to be your moderator for today. Now, a little bit about the context here. The impact of COVID-19 has no doubt put a spotlight, and pressure for that matter, to all countries globally, particularly for developing countries. The focus on healthcare infrastructure has climbed up to the top of the priority list for many of the governments. Indonesia is no exception in this case, having the fourth largest population in the world. According to figures provided by the Ministry of Health, last year, Indonesia currently has about 322,000 hospital beds. This translates into about 1.2 hospital beds per 1,000 population, significantly lower than some countries in ASEAN. And as of January 2021, Indonesia has close to 3,000 hospitals with 81,000 hospital beds ready to treat COVID-19 patients. Again, this equals to 27 beds per hospital. But the Indonesian government has also asked all the red zone regions to increase their beds and other supporting elements in the healthcare sector to 30 to 40% to help cope with the management of the pandemic. Now, there's a number of other things actually that the government has done. The Ministry of Health has also issued a circular that allows health workers who has just finished their study but not yet received their legal authority to practice to be recruited in hospitals specifically to help treat COVID-19 patients. And the Minister of Education has also called on medical school students across the country to join the Task Force Volunteer Program. The question is, how can we ensure and guarantee that these would last in the future? Now, we know that in many countries in the world, these challenges are not to be dealt with by government alone. The current situation also, in a way, creates opportunities for businesses, as well as new areas for partnership and collaboration, i.e. in the digital health tech, for example. The last 4 or 5 years, a range of digital health companies and digital health solutions have emerged in Indonesia. How can we bring this future into the table for Indonesia? So today we will discuss about the role of digital technology in shaping the future of healthcare infrastructure, plans and supports from the private sector, the financing and insurance side of it, and overall probably solutions to improve the healthcare infrastructure in Indonesia. So without further ado, let me introduce our esteemed speaker. The first one, we have Dr. Lia Partakusuma, Secretary General of the Indonesian Hospital Association, or PERSI. Currently, she is also the chair of Medical Waste Subdivision for the COVID-19 Task Force. Dr. Lia has her medical degrees from Pajajaran University and University of Indonesia, and she obtained her doctoral degree in epidemiology from Gadjah Mada University. Dr. Lia has an extensive experience working across many government hospitals, and her last position was Director of Planning Operations at Harapan Kita National Cardiovascular Hospital, Jakarta. Welcome and thank you for joining us, Dr. Lia. Next, we have Ibu Dian Budiani, Chief Operations and Health Officer of Prudential Life Assurance, one of our sponsors for today. She has a medical degree as well from University of Indonesia, with more than 20 years of experience in both life and health insurance. Ibu Dian is acknowledged as a qualified insurance expert by the Association of Insurance Management Experts in Indonesia and the regulator OJK across both conventional and Sharia insurance businesses. Thank you for joining us, Ibu Dian. We also have Mr. Jean François Trebillod, ASEAN General Manager of Aden Services. Now, based in Singapore, Jean François is in charge of the development of Aden Group in the healthcare and energy sectors in ASEAN, specifically promoting the digitalization of the facility management activities of the group. We will hear how Aden Group proposes to revolutionize construction and management of healthcare facilities, combining technology and world-class infrastructure management. Last but certainly not least, I'd like to welcome Nathanael Faibis, founder and CEO of Allo Doctor. Allo Doctor is a leading digital health company in Indonesia, as we know, with over 26 million monthly active users. Pardon me, Nathanael, perhaps actually this number has exponentially grown since the last time actually that we picked it up, but you can correct me later. They are changing Indonesia's healthcare by making critical information transparent, accurate, and easy to access, particularly given the demography that we have in Indonesia. Nathanael is a seasoned tech and healthcare entrepreneur in emerging markets, and he was also part of the core teams that started Lazada in Vietnam, Indonesia, and other Southeast Asian markets. I will now give each of the speakers 5 to 7 minutes time for their opening remarks before we start the discussion. And to all the participants, there will be a Q&A session following that at the end. So I would encourage all of you to post your questions using the Q&A box. I know we are in for a very exciting discussion. Let's start first with Dr. Lia. Dr. Lia, over to you. Tell us about the current situation with regards to the hospitals and the infrastructure on the healthcare in Indonesia.
Okay, thank you, Mr. Rino. Can I share my screen, please?
Yeah, sure.
Of course.
Yeah. Okay. So first of all, I would like to thank you very much for the opportunity to speak or share to all of you. And I would like to apologize for Dr. Kunchoro. Dr. Kunchoro is president of Indonesian Hospital Association. I'm a Secretary General of PERSI, or Indonesian Hospital Association, and I try. Maybe it's not very complete about the future of healthcare, especially for challenges after COVID-19 era. Okay. Thank you very much for the opportunity, especially for from BritCham Indonesia officer and also Mr. Rino, the moderator, and all the speakers. Okay, I try to in the short slides with the infrastructure in Indonesia and what is my opinion about it. this is the number of hospitals in Indonesia. From the data from Ministry of Health 2020, the number of the hospital is 2,924 hospitals in all Indonesian provinces. In Indonesia, we have 4 categories for the hospitals. It's class A, B, C, D, and it's smaller than, we call it Pratama. So most of our hospital is type D or class C or type C. It's about, the number is 1,524. And from all the hospital, it is a lot of general hospital, 2,394 hospitals, and most of them are private hospital. So its number is 758. And another hospital, then a private hospital, is a government hospital. We have also, we call it RSUD. It's a government, is under government in every provinces. Also, we have corporation hospitals and also from military hospitals. Also, there are BOMN, it's a corporation also. From all the hospital, just only 35 hospitals is under supervision or direction, contact, coordination with the Ministry of Health. It's about the COVID-19. Number of COVID-19 patients still increasing. Maybe this week is decreased, but we don't know whether 2020 will stop or higher or will stop. This is the data 16 February from task force, COVID-19 task force. The number look like decrease, but we don't know, maybe after a week, because on last week we have Chinese days. So maybe a lot of people in Indonesia go to some places, and maybe after 2 weeks, in another experience, that in 2 weeks after the people come or visit every country, every place, they are increasing the number also for COVID-19. So total cases in Indonesia is 134,272 in 2 weeks. So I think it's I don't know, it's a good news or bad news for us. And also this is the number of cases, active cases is 158,000. And this is the number of specimen we test to 26,300, and also confirmed patient for COVID-19 is about 1 billion patient. And this is the number of patient, it's better now, so they're healthy now. And this is the mortality of cases COVID-19. And nowadays we also have the vaccination. The first priority for the vaccination is for health people in the hospital, in the puskesmas, and then after that, we try to another target is for the elderly people and also for comorbid people. So we hope that it is help to make decreasing number of COVID-19 in our population. So what are the problem for health infrastructure in Indonesia? So Indonesia is currently trying to look for the future and the various obstacles that exist COVID-19 pandemic. And also now we have facing the various natural disaster and the lopsided healthcare provider industry. We have underinvestment in preventive medicine and primary care. So this has led to an expensive hospital healthcare system. Another problem is highly uneven is the distribution of health outcomes across geography and income bands, exacerbated because the country is an archipelago. It's about maybe more than 15,000 islands, distance 5,000 kilometers. So you can imagine our population is more than 200 million now. An underdeveloped payer market resulting is misaligned incentive for the healthcare industry. and also an acute skill shortage in key healthcare profession. So one thing that has good leverage, I think, is digital transformation or digital innovation in digital health ecosystem. Digital transformation in healthcare are very, very useful for administration, financing issues, insurance. We know that we have like a nation insurance called JKN, Jaminan Kesehatan Nasional. Now also we need we know that we are now in the rise of on the demand healthcare. We need importance. We need the big data in healthcare. We need treating patient with virtual reality. We need growth, or we need the wearable medical devices. We need the predictive healthcare about the artificial intelligence, maybe blockchain and better electronic health records everywhere. Also for our referral system, especially for pandemic information system like now, and also supply chain management for pharmacies, vaccines, equipment, diagnostic, etc., and home monitoring system for elderly or chronic patients, building automatic system for safety hospital, and we know facing the overcrowded hospital. So we need a one data for our ecosystem, from the medical claims, or maybe like a hospital emergency, hospital medical record maybe, and also diagnostic, and also private payers and plan claims, government health plan claims, and the other issues. And then we know that the data is very important, because the principle of garbage in, garbage out. If we have like a good data, so we have like a good data also. We need using of data in responding to COVID-19. We need supporting provision of health services for patient or supporting function. We need for the data for monitoring and surveillance. We need mass tracking. We need how moving to individual tracking and contact tracing, and also the communication. And the other thing is digitalization in healthcare. I think it's very, very important. We need maybe using cloud, move data faster, and then maybe we need home-based healthcare for telehealth, teleconsultation. There are online. There are a lot of hospitals, they use the online system in our hospitals, but maybe it's just only in the big hospital in Indonesia. So in healthcare industry, we need robotic, maybe there are minimal invasive system or surgery. So or maybe there are artificial intelligence robot virtual, maybe. We need innovative manufacturing and facilitating fast response. We need the hospital or health system with the safety and quality in everywhere in our, and we need everything about how back to work to make our hospital safety. We need disinfection service. We need also how to test, and also how to tracing and to monitor. And digital health, I think it's very, very important for being safe for our doctors and also nursing. I don't know, maybe because COVID there are negative issue, but we should have like a give also trophy for COVID, because maybe give us also the positive motivation to make the digital system in Indonesia powerful. There is another country that COVID-19 bring 10 major potential ICT opportunities. So we can use for digital platform, and then smart cities, maybe online healthcare services, classroom and education, office, like now we have a lot of working from home, and then 5G industry application, and then commerce and services, and food also commerce, supply chain management, and manufacture and service. So there's our president said that nowadays there are 15 billion people using the application. And how about digital transformation plan in Indonesia? We have national strategic for AI in Indonesia, 20 and 2045. There are several strategies in that kind of book. Maybe you can open it, and maybe we can learn together how to make Indonesia better for using the digital transformation. So I think it is, from my opinion. I hope that it's not too long, but useful for me. Thank you very much.
Thank you so much, Dr. Lia. I'm sure actually I have a couple of very interesting things, but we'll get back to you. Now, Ibu Dian, would you like to share some views from the insurance perspective, particularly from Prudential side?
Sure,
the floor is yours.
Thank you. So hi everyone. Thank you for having me in this BritCham webinar. Hopefully you can see my slide now. The topic is very relevant, like Chris mentioned earlier. I haven't seen my slide. Okay. The topic is about healthcare infrastructure in Indonesia. If we can just go to the next slide, please. From the 2020 census, actually in Indonesia, we can see that from the 270 million populations, more than 50% are Gen Z and millennials. I think you need to show my next slide. And 21% is Gen X. And as predicted, more than 50% is concentrated in Java Island, only in one island. And yes, that's the 2020 census which I am referring to. If we can go to the next slide, please. Dr. Lia has already mentioned that Indonesia is the largest archipelago. We have challenges in healthcare delivery. We have challenges in disparity of medical professions, and also challenges in affordability and some health conditions. So to overcome these challenges, we were thinking that widening the healthcare access is very important. And like also Dr. Lia mentioned, technology definitely can help a lot. We need to also empower our populations with a tool to access more health information, for them to understand more about their health, so they can control their health by themselves. Next, please. Okay, if we're talking about Indonesia, widening access to healthcare means reaching out to these 34 provinces and more than 351 cities. If this can be done, it would be very relieving for the Indonesian government. But now, how are we going to widen the healthcare access to such a large population? The next slide, please. Technology is the answer. I'm very happy to hear Dr. Lia mentioning also about technology and digital. Let me share what we learned in Prudential by using technology. We officially released an application called Pulse by Prudential a year ago with the goal to make healthcare services accessible and affordable for everyone. So the animo has been very positive. We have more than 5.7 million Pulse downloads currently and supported by our partners. So we have free features in Pulse actually. So this is not only for Prudential customers, it's really for public. The free features here include the baby loan, which is the AI triage symptom checker, health assessment and digital twin. We have fitness tracker and activities, articles, food journals, etc. And for Prudential customers, of course, they can enjoy more, which is the finding hospital and doctors, which can navigate them from their location, enjoy online doctor consultation, medicine purchase delivery, checking their policy benefits, and very important, whenever they need to be hospitalized, they can access their medical cards electronically via Pulse. Next, please. Let's use a persona to make it clearer and for better understanding. Someone like Putri here. She's healthy, she's an active millennial, she has routine exercise, and she wants to maintain her shape. She's fit and energetic. So for Putri, she can use the Babylon features of health assessment, where basically she needs to answer some health questions until she can get the health assessment. This will then show her digital twin. Digital twin is actually a kind of avatar showing highlights in part of bodies which needs attention. So Putri can take a look at that, and also can use other features like fitness and activity tracker, meal planner, food journal. She can join the community, because in Pulse community, she can meet other users with similar interests, and also reading articles on health and wellness. Next slide, please. So if we already know Putri, can we move forward? Yeah. So this is Putra. let's call him Putra. Putra is having a chronic disease. So how can Putra use Pulse? Of course, he can use the same features like Putri, but then he can also use the AI triage symptom checker anytime he gets symptoms. So the symptom checker is basically a chat supported by AI, which can help suggest what medical conditions he might have, because Pulse is not a medical device. So any symptoms which is significant, Putra will be recommended to do a doctor consultation. In Pulse, we have it online. Putra can also monitor his body mass index, for example, and use the other features available. Next, please. So in this slide, I would like to share what Babylon in the UK has done. It shows that the digital medical assessment really reduced medical consumption. I think this is very much related to Dr. Lia's presentation. So there is evidence that health technology benefit patients. 75% in this study goes online for health consultation. And then patients with COPD, for example, the chronic pulmonary disease patients, it is showed that they're highly satisfied, better treatment compliance, and also it reduces the readmissions to hospital. It reduces the doctor visit, nurse visit, because we have mobile and remote monitoring. So in overall, digital medical assessment can be benefited by lower admission, better adherence to treatments, and also effective use of medical resources. So, but that is UK. What about Indonesia? We have some learning from Pulse data in Asia, where we have 5,000 respondents in 13 markets. So the learning is Indonesians use internet and social media to find out about health information. Indonesians have higher acceptance rate for healthcare technology compared to other countries in Asia. And almost 50% of respondents agree to use more technology at improving their health. Next slide, please. So I think these are very encouraging news that Indonesians are embracing digital technology. So to close my presentation, I would also like to share that Prudential also integrated Pulse with our Pro Medical Network, which is a network of around 2,300 plus hospitals, clinics, and optics, where we have direct agreements with each of them. To serve both our individual and group clients. So technology and innovation has indeed made us possible to deliver a more transparent and smooth customer experience during hospitalization, supported by a 24/7 customer care for our clients who need to undergo treatments domestically as well as overseas using cashless guaranteed by Prudential. So I guess this is the end of my 7 minutes presentation. Thank you for listening. Hope there is some insights and proof points that technology really can improve healthcare access.
Certainly, Budiani, thank you so much for that. And we'll get back to you actually with some questions. But let's now move to Jean François. I understand that you're going to explain about your Akila Care Project, and we heard from Dr. Lia earlier on how hospitals would really like to embrace digitization, data analytics and so on, actually, in how they operate going forward. The floor is yours.
Yes, you're right, Rino. Before I introduce our Akila Care concept and project, let me just introduce briefly what Aden Group is. So if you could put the slide on, please. It will be very short, a short presentation of Aden in order for you to understand who we are. So Aden is a facility management company. It means that, next slide, please. It means that we propose our clients to manage all what is their non-core businesses, okay? If you are an industry, you are good at what you do in terms of industrial matters, but we manage for our clients everything which is not industrial matters, meaning cleaning, maintenance, catering, etc., etc. Next slide, please. So we have a strong presence in Asia. We were born in Asia to serve Asia. We have more than 2,000 clients. We have 26,000 employees all over Asia, more than 1,000 employees in Indonesia. And we are a 100% private group supported company with three major shareholders, which are all French and very high technology, most of them. Next slide. So this is here a short slide regarding our position and footprint in Asia. You can see that we are very strong in Asia, but also in China, but also in Southeast Asia, but also in some countries like Africa. Next slide, please. Yeah. So if I go very quick on Southeast Asia, we have 9 countries where we serve our clients. Indonesia is one of our major countries in terms of volume of activities and number of clients. Next slide. And here, this is a very brief slide showing the organization of the group, where we can see at the center that we are a facility management company, but we have opened step by step some other branches, such as energy, rental systems, and also, if you go on the right side of the slide, an healthcare branch, which is named Akila Care, and is what I'm going to introduce you later on. Next slide. Okay, so talking about the future of healthcare infrastructure in Indonesia, I would like to thank Ibu Lia for the very interesting statistics that was shared previously. Myself, I did some very basic homeworks, and I've collected two interesting numbers showing what is the situation of Indonesia in terms of healthcare. Today, in terms of number of beds in Indonesia, okay, we have 1.2 beds per 1,000 people, 1,000 Indonesian. And in comparison with the neighbor countries such as Malaysia, Thailand, and Vietnam, it is very low. And it is also similar for the number of physicians, meaning people having got a healthcare profession. It is 0.4 physicians per 1,000 persons in Indonesia, which is very, very low as well in comparison with other countries in ASEAN. So there are, in conclusion, 2 major stakes in Indonesia that we have to answer. First, the volume of beds. We are talking about capacity and availability of physicians. Next slide. Okay, so this is Akila Care is the answer that Aden would like to bring in such a kind of stakes. And the question is how the digital-based technology, which is represented by Akila, how this technology can answer and facilitate the construction of hospitals and give more base capacities in a short time. How this digital concept can help in optimizing the medical services and giving more capacity to the medical staff, and how the digital system of Akila Care can bring a better and accuracy in hospital operations. So now I will introduce to you what Akila Care is. Next slide, please. Alors, Akila Care is an hospital, okay, what we call a smart and connected hospital, in order to answer this question. Next slide. Yeah, so it is, we have designed this hospital in terms of sustainability, in terms of answer to the digital healthcare ecosystem, and also in terms of long lasting. So we can see some screens and some pictures of the hospital. Next slide. Alors, when we talk about digitalization, first of all, the design of the hospital has been based on digital softwares. This hospital is completely designed with a Dassault system, 3-dimension module system. It allows us to design in a very short time and to imagine an hospital which is based on a modular blocks, okay, which is very cost effective and very easy and fast and quick to operate. Next slide. So at first we imagined to deliver a turnkey hospital, something which is in one block, one-stop solution which can be given to our clients, where you can find everything in terms of facilities, in terms of water supplies, power supplies, etc. But later on, we opened this conception, this design, to a more adaptable, more adaptive, and more flexible design. And the next slide, please. So based on this first block, we can also adapt our solution, okay, to different priorities in terms of disease, and we can add some new blocks such as a maternity center, diagnostic clinic, patient towards X-ray imaging, etc. So these blocks can be adapted based on the needs of the clients, on the needs of the country we would like to answer to. Next slide. Of course, this hospital can be set up, can be delivered in every place. It is a completely autonomous hospital, which includes already all the technical systems, the power system, the water supply, and the contaminated medical waste. It means that it answers to the remarks made by Ibu Lia previously, talking about how large is Indonesia, how complex is Indonesia in terms of geographic situation. So we are able to set up such a kind of hospital in the very remote places without any existing facilities or very limited facilities or infrastructures. This hospital can be fully equipped with all the medical equipment, such as operating room, radiological equipment, respirators, etc. So it can be provided in one block, in one-stop solution to the client. Thanks to the digitalization of the design and the software system, we can also design what we call the negative pressure isolation rooms. So we can also adapt our hospitals to the coronavirus, to the COVID-19 fight, in order to make sure that we are not going to infect the other parts of the hospital. So we can have a negative pressure in the rooms. And next slide. And thanks also to this digitalized tool, we can simulate what could be the spread of the virus to the other parts of the hospital or outside of the hospital in terms of neighborhoods. Another thing also, when we talk about digital, the Akila Care system can bring us also a software who can help us to maintain and to operate the hospital later on, which is a job of Aden, by the way. So, and giving us dashboards, data, information about how the hospital runs and how we manage this hospital the more carefully and with the maximum of quality and security as well. Here you have the description of what is the digital solution globally, okay, from the early beginning, the project collaboration. We start with the client to define what will be the need and what will be the project. Based on the digital system, we can design it, we can engineering it in details with a software as well. We can manufacture it in a manufacturing plant. We can also manage the transportation and logistics through this software. And then also we can manage the installation, the erection of the hospital, and the training, the digital training of the operators of the hospital, and later on to operate and to maintain the system.
Sorry, Jean François, maybe another 30 seconds so that we can have more time for the question.
Please go to the next slide, please. Yes, this one is interesting. Yeah, that's one. Thank you. At the end, this hospital, Akila Care, is a completely digitalized and connected hospital. So in this slide, you can see that it can be connected to medical devices, the facility management operations, the patient identity, biometrics, and all the applications that can be created. Allo Doctor is one of them, and everything in terms of infrastructure communication. So our hospital is at the center of the healthcare ecosystem, I would say. Okay. Next slide. And when we talk about Akila Care, of course, we talk about telemedicine. This is what we have been talking and what we are doing to talk with Nathanael. Medical training by simulation. So this hospital can participate to this training. And also we can also participate to the health information exchange, the HIE, so the data sharing about the patient. And then the last one. And we can imagine that, next one, please. Yes, we can imagine that with digitalized and smart hospital, if we connect them on a unique platform, they will share the best practices. They will be able to improve their own system on a permanent and continuous path. Okay, so I'm done with my presentation. Thank you very much for listening.
Thank you, Jean François.
And let me know about any question.
Yes. Nathanael, now moving actually completely no brick and mortar. Again, the way actually that you revolutionized, we heard about the need because of the archipelagic nature of our country. And I think actually Allo Doctor really sets such to address and provide the right solutions to greater healthcare access to the people of Indonesia. So the floor is yours.
So thank you very much for inviting me. I'm going to be fairly brief on my side on the introduction, so that we can go to the questions. So, Allo Doctor is a company we started in 2014 with the objective of providing accurate medical information that people could trust. So what we were seeing was very simple. So people were going more and more online to look for medical information, to look for medical support. But basically, the support that they were getting online was of very poor quality back in 2014, and we were seeing people around us taking very bad decisions for their health. Based on what they were reading online, right? So the objective of our company is to provide information that has information and services that are accurate, reliable, and trustworthy. So today, Allo Doctor is a full ecosystem, digital ecosystem for healthcare with telemedicine, medical content, booking appointments with doctors, e-pharmacy, and also a platform for doctors called Allo Medica. Today, as you mentioned, we have a platform with now more than 29 million monthly active users using Allo Doctor every month. So it means that basically more than 10% of all Indonesians will use Allo Doctor at least once a month on our platform. So why is health tech and healthcare digital solutions are growing in Indonesia? I mean, that's a trend that is worldwide, right? Basically, healthcare is about information in general. And information can be found digitally in a very non-similar manner for many cases, right? So you cannot solve all your case, but basically you can find information digitally fairly easily. Then you have the question of access, as it was mentioned here, right? I mean, there's a very uneven distribution of doctors in Indonesia, and for many people, digital is getting the #1 way to access doctors, right? And we believe it's going to grow in the future. I mean, it's going to take time to solve the uneven distribution of doctors across Indonesia. And for some people, I mean, they have to basically transport themselves for a few hours to access to an hospital. You have also an issue of access that will be more about the simplicity of access. If you use a platform like us, basically you can speak with a doctor within 2 minutes for any specialty at any moment of the day. It can be on a Sunday at 3 a.m. and you will be able to speak to any specialist on your platform, while let's say when you go to a normal hospital, it may take you half a day to see a doctor for 10 minutes. So you have definitely a convenience aspect that come into play as well in the accessibility of the platform. Affordability as well is a big reason why people are moving online. So because with online you have different cost structure, the cost of consultation can be cheaper. We believe as well the cost of medicine in general can be more affordable, and we see people flocking online as well to access more affordable solution. And the last main reason that is basically making going the trend is it's a question about trust. So many patients in Indonesia have troubles to decide which is the right doctor for them. And with online platform, you have more element of choice for patient to choose who is the right physician for you, right? So either it can be the location, it can be information about capability of the doctors, or the patient review on the platform, or the fact that our doctor is doing their best, for example, for telemedicine to vet doctors using our platform, right? So people are going online for accessibility reason, affordability reason, and basically being able to find the right doctor that they can trust on their platform. In addition to that, obviously, you have the COVID situation where people got more scared, I believe, to go in hospital and get sick while going to the hospital. So, and with the support as well of the government, of Kemenkes, also the strong support from Ikatan Dokter Indonesia, which has been very supportive of teleconsultation initiative since our inception for us and for other companies in the sector. And basically it helps as well grow the trend of digital healthcare as to bring more doctors coming online to provide medical consultation, and also more patients coming to basically get consultation online. So how do we think that this is going to evolve? So number one, we think that basically most players in healthcare, whether they're most offline players in healthcare, are going to partner with solutions like us. So basically, in some way, there's going to be utilization of many healthcare players on their side. And I believe that more and more, the more we go, there's going to be a seamless integration between offline players and online players, so that basically patients can manage their journey from online to offline in a seamless manner, from a teleconsultation to an offline visit, to a lab test, to getting access to the right medicine. So we see the evolution of more and more partnership between offline players and online players. There's going to be a big trend that's already happening, and it's a big trend continuing in the market. We believe that there's going to be also more and more AI, basically solutions inside digital health solutions. So I saw today, for example, 80% of our chat are supported by AI. So our doctors are supported by AI to make the right choice. So it doesn't mean that the AI is replacing the doctor, but it means that our robot is supporting the doctor to determine what is the case, help them in the diagnosis, help them in their recommendation, and then it's up to the doctor to make the decision of what they would like to prescribe to the patient. And also a trend that's going to evolve, I think, more and more over the next few years is remote diagnosis solutions. So we have a lot of teams around the world working on remote diagnosis solutions through smartphone, some with IoT, some without IoT, some tools without tools. And we believe that more and more patients will be able to test themselves from the smartphone and basically get some information about their vitals directly from their smartphone in the future. So that's basically the big trends that we are seeing coming forward worldwide and also for Indonesia.
Very interesting indeed. Thank you, Nathanael. Can I just now quickly go back to Dr. Lia? Dr. Lia, let's start actually with some of the discussion. So again, as you mentioned, no doubt Indonesia would need a lot more hospitals. Now, how do you see that we can attract, particularly from the Association of Indonesian Hospitals, how to attract the private sector to invest more, whether that's private sector domestically or in the form of foreign direct investments? What is it actually you see that the private sector can do to help? What's the allure? What's the appeal?
Okay, thank you very much for the question. It's very interesting question. So we know that the number of hospitals, maybe we need to add more, but the very first important thing is to have like a mapping where the place is the correct place to investing the hospitals. And also we know that in Indonesia now we had a government provinces have their own policies. So first you should have like a mapping all the Indonesian health situation. Also you learn about the diseases, maybe about the number of people, and then you can contact the people in that province and learn for it. And for the private hospital, I think there are a lot of projects. We call it the PPP, is a private and government hospital. We can have like a FS, is feasibility plan to know that the one province need more hospital. So you can contact the provinces, the head of provinces, and then maybe you can discuss about it. Or you can contact Ministry of Health and you search the data there, because they have a lot of data for the number of diseases in their system. We call it as Rumah Sakit Online. But if you don't have that kind of that kind of system access, you can contact Persi. you can contact Percy, and we try to go to the provinces that you would like to have the information. Maybe I think it's that. So very important to have a mapping for Indonesian situation.
Thank you, Dr. Lia. Perhaps actually as a follow-up quick question, because I know among our audience actually there are a number of interested investors in the healthcare sector. Are there any incentives, fiscal or otherwise, that the government has put in place given the need to have more healthcare infrastructure in Indonesia? And if there isn't yet, actually, do you think actually that needs to be instituted?
Yeah, I think it's very important, because otherwise we need the facilities, we need the infrastructure, but I don't know, a lot of investors say that maybe rather difficult to have investment in Indonesia. So it's, I think, not more. There are several investors came to talk with Percy, and they said it's very difficult because there are bureaucracy. But if we can have like some, we try to have like some proposal, the good proposal, and then maybe we can learn what is the important thing about the spatial proposal. Maybe we can try to introduce, or we try to have like a investment in that area. But yes, it's very nice if we have like some it's easy to contact the investor in Indonesia first, then from outside Indonesia, then foreigners. Yeah, maybe we need to contact and talk with the government.
Thank you. I'm sure Persis is doing that, and of course, BritCham will be very interested actually in connecting also with Persis in that regards. Just moving quickly to Nathanael, I just a few follow-up questions. Actually, I picked it up from our Q&A box here, and there's a couple of questions that are very similar. But you talk about telemedicine, but also, obviously, actually in the digital space to the next level where doctors can operate remotely and so on and so forth. How soon will that really become a common practice in Indonesia, in your view? And how do we mitigate? I mean, technology does have from time to time its, disruptions, if you will, whether it's intermittent connectivity and so on. So how do we avoid that? How do we cope with that kind of challenges?
Which challenges? Can you repeat which challenges are you mentioning about?
Now, we're talking about how soon will Indonesia see common practice of not just telemedicine, but also the AI becoming major provider of health advice, as well as doctors operating remotely, for example. Now, that's one question. The second question is that technology sometimes, and connectivity for that matter, actually does have its challenges, whether it's intermittent services and so on and so forth. So how do we ensure that during life and death situation for doctors operating remotely, for example, how do we avoid that? How do we mitigate that?
Mm-hmm. So a few questions, right? So telemedicine is becoming more and more frequent in Indonesia, right? And I think it's actually already a really common practice, right? So on our side, I mean, we are doing every month more than 600,000 teleconsultation a month, which is by far more than any big hospital chain in the country. So it's already happening quite a lot, and almost every doctor in Indonesia are already speaking with their patient on WhatsApp. So it's happening on platforms, already happening as well on WhatsApp. Most hospitals as well are basically setting up their own telemedicine system. Sometimes it works through Zoom, sometimes it works with telephone. But basically, a lot of doctors are going remotely, either on platform like us or basically directly on their side. So the trend is already, I think, quite advanced in Indonesia. In terms of AI as well, it's not science fiction, right? I mean, for example, a company like Pinggan Doctor in China, they're able to manage 95% almost fully with AI. In China, us, as mentioned, I mean, 80% of our teleconsultation are supported by AI. So this is not science fiction, right? It's mostly on the background, so people will not see it. One thing to remember is that all the teleconsultation and Hello Doctor happens through chat, not with video call. So basically, that enables a lot of support from AI during teleconsultation, right? So we believe that we have one of the most advanced AI systems in the world, even though we also believe that companies in China are more advanced than what we do today on our side. And also say there's a lot of support that can be brought to doctors through AI. That's already happening. I think that where there's a lot of improvement to be done is on remote diagnosis through smartphone. A lot of companies are working on it. They're super exciting companies working on, for example, being able to calculate your blood pressure through smartphone, understanding what is your respiratory disease from your cough, sound, for example, trying to see if you have any heart condition by just listening at your heartbeat. So many companies working on this. They are in different stage. At this stage, many of them are working on getting FDA-like approval in their own country, basically, and that's going to happen, I think, in the next few years, right? So it's already happening. It's not science fiction. Today, it's already happening in Indonesia as well. And in terms of remote diagnosis through AI, we believe it's a trend that's going to explode over the next few years, and that is going to change a lot the way healthcare is provided by healthcare professionals around the world. In terms of challenge of connectivity, so we on our side, I mean, we are not to the level where we are helping doctors to make surgery from remote and everything, right? So it's mostly, let's say, a typical consultation that you will have face to face, but basically via a phone. And for most places where you have a normal internet connection, basically it works perfectly. So it's not a huge issue for most of our consumers. I mean, the main issue is basically 4G or 3G coverage from the major telco company to cover all around Indonesia. And what we believe is that the further you go from big cities, the more services like us are useful and critical for patients.
Very interesting. So, Nathanael, essentially, actually, it's not that long then that we will see actually what you're describing. I mean, again, actually, we probably actually can supersede China in the next few years. So that will become actually more sort of common practice. So let me move down to Ibu Dian from a financing side. You mentioned about two things essentially. So I'm also picking up actually a question from the Q&A box. But number one, you mentioned about affordability. Now, can you explain a little bit more about this? And the second question is with regards to your platform. Again, this is something that quite interesting. Pulse and Babylon. Why do Prudential decide actually to move beyond its core business, if you will? Although it is indeed very helpful because again, the preventive sort of healthcare plays a big part as well, and we're lacking of that according to Dr. Lia. But any issue in rolling out this technology from Prudential side?
Okay, thank you, Padoni. When I say affordability, actually is the affordability of the people of Indonesia to get quality healthcare. We are very fortunate that in 2014 we have the Universal Healthcare Program, the Jaminan Kesehatan Nasional, which is helpful to provide the essential cover for basically all Indonesians. And we can see also there's opportunity for private insurance like Prudential to join with the JKN, the Universal Healthcare Program, to provide comprehensive on top of the essential cover. To answer your second question on platform, why do Prudential move more than just providing insurance, yeah, Padoni? So basically, our aspiration is to help people getting the most out of life. So we would like to empower people to live healthier and wealthier. And to achieve this aspiration, we go beyond our core health and financial protection. So we offer to play a larger role in helping people to prevent and postpone the onset of diseases, and also empower a community so they can live a healthier life, basically. So we have a couple of activities in health, like the virtual ride, cycling, virtual walk and run. We have a couple of wealth activities also, like financial literacy, and also young entrepreneurship in Papua, things like that, because we believe that by fostering all this will really make us grow more and achieve our aspiration in Prudential. And I think you have your last question is on the rollout, yeah, Pak Doni?
That's right.
For Prudential to roll out a platform, it is a new skill for us actually. So we need to learn. We also need to engage with multiple stakeholders, from our sales force, our clients, our internal staffs, hospitals, how to make all hospitals come into that same platform. That's a challenge, and it's an interesting challenge. We also have to have a win-win solution with our partners in Pulse, because we want to grow together. If we are successful, we also want our partners to be successful. And also one learning is we try to connect our clients who are willing to use the features in Pulse, so that they can have also a financial benefit. So when I say that, for example, diabetic clients, they pay higher premium, but then if they demonstrate a healthy lifestyle using Pulse, then we can lower their premium loading, so-called, Pak Doni. So that's how we experience. Hope that
thank you, Budiani. Just one other question, actually. There's a pre-registered question, and you may have a view about this on the insurance side. Now, many corporations actually have been, of course, we do have BPJS, right? And it's mandatory. But some corporations may not necessarily use that, particularly if it's actually the middle management up kind of thing. Now, what do you think would be the best way for these companies to somehow get access to BPJS health funding, given that is mandatory, but rather than actually not using it at all? So any thoughts about this? I know this is a little bit of a cheeky question, supposedly, but you have any views at all?
Yeah, in my opinion, it's better to have BPJS for everyone. Why? Because we never know what will happen to our employees and to ourselves. We can always use BPJS to the basic essential cover, and you can top up with your other insurance cover, basically. So I think at the end of this year, if I'm not mistaken, the BPJS is launching a standard inpatient class. They call it like that. So if any BPJS user get hospitalized, definitely the essential basic cover is covered. But then whenever a more comprehensive cover is needed, then a top up from the insurance company, the private insurance company can support that. So I think that's beneficial. Yeah.
Thank you. Interesting. I would agree completely with you. Jean François, now about this Akila that you talked about. Interesting. A lead time of 150 days to establish a fully functioning hospital, right? I mean, that's obviously we're not just talking about COVID, but it will be something, a useful capability to have in event of a disaster, for example. Now, can you talk a little bit more actually about, how could you achieve this? And is it really fully functioning, as in fully operational? The second point is about, Aden Group. Are you intending to create this model in Indonesia, your Akila Care hospitals? And how do you attract partners, whether local or investor partners, into the project in Indonesia?
Very good questions, Pak Doni. First of all, yes, we have designed these Akila Care hospitals in order to be erected in a maximum of 150 days, excluding importation matters, custom duties, etc., in case we would need to import some devices. It was important for us to stick on this very tight schedule, because the early beginning of this project started with the start of the COVID-19 infectious disease, and we wanted to answer in a very quick way to the immediate needed needs of the countries. So that's why we have imagined this concept, which is able to be erected in 150 days. So it remains like this today. So the way we achieve that is because we have first we have pre-designed many of the components of the hospital, right? So the hospital is already pre-designed, and we just have to tailor-made, to fine-tune it in accordance to what the client needs and expects. So it's a very short term of redesigning phase. Secondly, all the rest of the production, all the rest of the fabrication is mostly industrialized. It is made in a factory. Okay, it means that when we start the erection, the construction itself, everything has been already manufactured and made. We just have to assemble the blocks and to make sure that everything is done properly. So the way we achieve these 150 days is mostly based on a pre-definition, pre-designing of the system, and a full follow-up of the production and implementation of it through the Akila software, which is made and proposed by Dassault Systèmes. The second question, Pak Doni, is about how we attract potential partners. Of course, first of all, for us, Indonesia is one of the major countries in ASEAN where we operate, and Indonesia definitely is for us an important country where we think that Akila Care has a future, because of, for example, what Ibu Lia told us before. There is a need of health infrastructure, a need of beds, a need of hospitals as well. And also because it is also very difficult to access in some parts, such as she mentioned Papua previously. So building an hospital in that part is very complex. So for Aden, Indonesia is very important in our schedule. How we attract our partners? It is a very good question. The way is that we need partners, definitely. We cannot build, erect an hospital by our own, okay? We are not an hospital operator, we are not an investor. What we can bring is our technology. What you can bring is how know-how in terms of EPC, engineering, procurement, and construction, because we have the teams in Indonesia, this team is very strong and knows how to manage this kind of project. And of course, we need to attract some partners in terms of financing, in terms of licensing, in terms of operating. And this is the challenge today for us, right? Yeah.
Very well, thank you. And surely, on my other hat from Standard Chartered, we will have a separate discussion with regards to that. Thank you. I think actually time is running up, but I will give an opportunity for all the panelists actually to say your last thoughts, last words actually for maybe 30 seconds or so, starting with Dr. Lia. Anything actually you would want to leave to the audience?
Yeah, thank you very much for the opportunity. So I think, yes, Indonesia need to collaboration with somebody maybe who has technology, good technology, to help our health system. Healthcare infrastructure in Indonesia still need some improvisation, some innovation, and also, especially for me, digital is very good point for helping all our structure in Indonesia. And also for Mr. François, Akila is very nice. Yeah, it's very maybe in this situation, which is we need the search capacity in the hospital. Maybe we can join maybe someday, maybe in another place in Indonesia.
With pleasure, Ibu. It will be a pleasure, Ibu. Yeah.
But can you combine the panels not made in your country, but also we can join together. Maybe in Indonesia there are a lot of things of medium for your hospitals, maybe.
Yes, of course we can do a lot of things in Indonesia. We can find, and we know that we have been in Indonesia since 2013, so we know the economical ecosystem in this country. We can find a lot of actors that can bring their own know-how in this project. Definitely, yes. Our aim is not to import everything. Our aim is to create something in Indonesia. and to build from the people.
So more than 50% local content then.
Yeah, local content is very important.
Yes.
Thank you for this question.
Thank you. Yeah. Thank you, Dr. Lia. Nathanael, any last words about the future of Indonesia's healthcare infrastructure?
So yes, we are very enthusiastic about the future of Indonesian healthcare. We believe that all the players on the ecosystem are trying their best to digitalize and to move into a new way of doing medicine. So whether it is the patients, the doctors, the hospital, doctors association, the government, I believe there's a strong belief in Indonesia that there's a lot of issues to be solved in Indonesia about healthcare, and that digital is going to be one of the way and one of the solutions that is going to help and support the evolution of healthcare in Indonesia, right? And that's not the case in many countries in the world, where there's a lot, I think, of resistance to this evolution. But in Indonesia, we see that most players are embracing technology, embracing that the future will be different, and I believe that will help Indonesia to improve the healthcare system dramatically over the coming years.
Thank you indeed, Ibu Dian.
Okay. I think firstly, it's great to see that the government is embracing the public-private partnership. So hopefully all the private sectors can collaborate to improve this healthcare infrastructure. And my second point is that, like President Jokowi said, that COVID-19 pandemic must be a momentum to encourage digital transformation in Indonesia. So let's use that momentum to create much better digital medical platforms and technology to further support the community. Thank you, Pak Doni.
I can't agree more. And Jean François, or you said
yes,
your last word?
A last word about our Akila Care Project. We think that today we are in the middle of a huge development of the digital healthcare. Okay, every day we can see new applications popping up every day, everywhere. But at the end of the day, we consider that there won't be any healthcare system, let's say a robust healthcare system, digitalized, I mean, without having in the middle of that a strong hospital system. And we do believe that Akila Care, the way it has been designed, meaning being capable to be interacted or connected to all the digital applications and systems, could be a part of the answer in terms of healthcare infrastructure for the country, for Indonesia. So considering only new application, etc., without having in the center a strong hospital, a modern hospital capable to be connected and to deal with all this data and this system is important to have in mind.
Thank you to all the panelist speakers. Unfortunately, that's all the time we have to all of the audience. I won't summarize it because I think the last words actually have summarized actually what we really discussed, and hopefully actually this discussion will give you some insights about the future of healthcare infrastructure in Indonesia. Thank you for participating, and I would also like actually to thank our sponsor for today, Prudential Life Insurance, as well as Rentokil International. And we hope you enjoy the session today, and until the next webinar series from BritCham Indonesia. That's it from me and all the panelists. Thank you all.
Thank you. Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you.